It's terribly sad that we have seen another 13 deaths in Victoria from COVID-19, of course. It's worrying that after all the lockdowns and restrictions and the mandatory face wearing, the mandatory face mask wearing, that they've still had this record number of infections today, and those masks mandatory orders now go right across Victoria into many regional areas too. Yet again, however, I think the alarmism and the hysteria here is often over the top from some politicians and certainly many in the media. We need a calm approach to a problem we've tackled for 6 months and we're still going to have to deal with for a lot longer yet. Victoria is a state of 6.5 million people where there are just over 5,000 active cases now and almost as many people who have had the disease and recovered so far. Obviously, those numbers should improve. Victoria has been lax on quarantine, it's been shoddy on contact tracing, it's made mistakes in aged care, and it's often pushed out mixed and confused messages. Besides all that, its wintry weather doesn't help, and people can't stay in lockdown forever. They resist. They alter their behaviour. So Victoria, of course, needs to get on top of this situation with the rest of the country. It needs to deal better with these issues. But now we've got Queensland with 11 active cases only, banning Sydney-siders because there are about 200 active cases in New South Wales. Remember, 99% of those are mild. There are about 200 cases in a state of 7.5 million people. So guess what's happening in Brisbane now as they block off the border even harder? Yep, they've got to run on toilet paper again. We are regressing, people, rather than learning from our lessons. We need to come to grips with living with this disease. You're going to get sick of the hysteria, the media beat-ups, the lockdowns, the restrictions, the border blockades as they drag on month after month and into next year without a vaccine. And you already know we can't afford them. We're in recession, we've blown the budget, we've burdened generations now with debt, and we've tossed 1 million or more people out of work. And that's 6 months into living with a virus that might be a permanent fixture. As I keep saying, we need to be discussing sustainable policies nationally. We need to be working out how to live with this disease. Masks, hygiene, social distancing, no mass gatherings, work from home if you can, protecting the elderly. These are no-brainers, of course, but a lot of other measures are unsustainable. I'll discuss these issues with medical and economic experts in the program tonight. But as an example of the hysteria, what about this front page? 2 Queenslanders who returned to their home state infected with coronavirus are branded as enemies of the state? In Melbourne and elsewhere too, the media targeted these women. They named and shamed them. Now, they've already been hit with fines because they broke the rules. If they've broken other laws, they'll be dealt with. It looks like they've been irresponsible. But so have a lot of people. And nobody asks to be infected with this disease. So let's not go over the top. Let's focus a bit more on personal responsibility and sustainable policies, not a police state backed up with public shaming. And as for those, though, who say that this sort of coverage about those women was about racism, give me a break. This woman got the same treatment for bluffing her way through a checkpoint and shamelessly posting her exploits on social media. And the police tracked her down too and arrested her. And other prominent people have had their photos splashed around simply for contracting the disease, even though they did nothing wrong at all. So it's not about racism, that's for sure, but I do think we ought to calm down a little. I can't say it more plainly. You've heard this on this program over many months from expert after expert. We must learn to live with this disease. It is not going away. We can't shut down, lock down and hide from it forever. Now, that doesn't mean let it rip. But even if you go into a situation like New Zealand now, where they don't have COVID cases, there's only 2 ways forward for them reopening their country. Those of you watching across the ditch now must be fully aware of this. Either there is a vaccine, if it happens tomorrow, you're the great winners. But it's likely to be months or even years away or might never come. Good luck waiting for that. So either they get the vaccine or they eventually are going to have to open up anyway and deal with the virus somehow, learn to live with it sometime. And it hurts you and it costs you every day you wait. These are tough choices. But it's been clear for a long while there are no easy options here. We have to choose the least worst option. And we haven't done that yet. We're currently in a situation that can't last the rest of this year, let alone all of 2021.